It's me, Memoirs of a Durán Doll.
I just have a hard time believing that could actually be me.
I'm here to give you the info on the BBL, Lipo, tummy tuck, and muscle repair. Everything that they didn't tell you so you could be best prepared for your journey in the Dominican Republic. Let's get started. I got stuck at the Western Union because I was Western Union myself money, right? Cash money. And I was having so many problems because banks weren't cooperating and they were saying like they didn't have any problem and that it was notated on my account and I should be able to pull money out and all this. And then it wasn't being approved. So, and then Western Union was blaming them. And anyway, long story short, if you're going to go out, and that took me several, I was there for like 4 hours, 5 hours. And then the traffic to get back at the time, it was so bad. It was like 2 more hours of traffic. Oh my God, I regretted that. So if you need to take like 11 or 12,000, not going to do nothing to your money in the airport, okay? The real reason is because you're going to have your faja on. Like, I mean, if you've waited like the week that Durán, you'll close your faja, give you your second faja from Fajate, which is a halfway decent faja. It's better, probably better quality than Casa Colombia, but it is kind of harder to get on in my opinion. But the legs are longer. The longer the legs, the leg part is harder to put on. So I get the one that's, I think if it would be a shorter one, but she gives you the one that goes to the knees. So I would prefer one that was like mid-thigh. That is the best one in my opinion to get on, because whenever you're struggling, it's just more of a struggle, and I feel like it compresses your hips more when it's a longer one. I don't know why. This is probably common sense. You will have to probably shit. And that's the reason why I'm saying don't stay off too many hours, because if you have to go to the bathroom and you have to put your faja back on and you're just operated and you have all these open wounds, that's not good in a public bathroom. That's just not a good combination. And if you don't have anybody with you that knows how to put a faja on, you're going to end up like me in the middle of Western Union asking random people in the bathroom to help you put your faja on. You don't want to be like me. Don't do that. Maximum, 3 hours? I don't know. Just don't be out too long. Plan your shits accordingly. You need your nurses. If you don't have a nurse to help you, don't do it. Don't go. Or if you're going to go, just make the one trip. Don't be like me, because I was an overachiever. I was trying to go to the mall and everything. Don't do that. You must always take your shiwi to all trips. What is a shiwi? It's the female urinal. So you must always take your female urinal, your shiwi, to all your trips and outings, shopping, appointments, anything you have to go to. You take it in a bag, like a little backpack or whatever it is you're going to carry with you. You need to take that. Also your BBL pillow. Everybody travels with that right after surgery. So you're going to be carrying that in your bag with your shiwi. You probably want to put some wipes in there and some hand sanitizer. You could even take gloves if you want. I do recommend you take like a big old pack of disposable gloves, because some of them nurses be poking you without gloves. When they put my IV in, they did not wear any gloves. They were not wearing gloves. When they put my injections, they were not wearing gloves. Let me tell you, even in the hospital, you can even take some of those gloves to the hospital. Just have those gloves with you everywhere. You need that shiwi so that you don't have to take your whole faja off, because it will save your life. You do not want to take your whole faja off to pee, okay? Because you have to be drinking so many liquids. You're going to be peeing a lot. Firm BBL pillows. Okay, so I really like this soft BBL pillow, and I was like, oh, it's so comfortable. But you want the firm one so that your ass is staying in the air. Now that I've had the surgery, I can understand why you want a firmer pillow than as opposed to a really soft one. So they sell different types down there. I would go with a firmer one. I would just buy it in Dominican from Natalia Boppy Pillow. She has a lot of really pretty designs. They do the job. And she travels to you, so she has very good customer service. She went to the clinic, and sold me a set of pillows. And it's nice. You can get like leopard print with pink, and, you can tell her what you want before, so she have it ready for you. If you want a specific color, you can look her up and you can tell her. And then she'll make sure she has it. If you're too uncomfortable, go soft. but get a firm one to take home. When you're getting to feeling a little bit better, you want to get out of that soft one as soon as you can. Do not clean your belly button or your incisions until the doctor says. Do not let the nurse, if she says, oh, we can do it now. No, don't do it. Just don't do it. Do not do that. Don't let her mess you up. You pay too much money. Okay, you listen to the doctor. You don't listen to that nurse. Tell her no, the doctor said no. Because Doctora Durán said no for I think it was the first week or two. Or I don't even remember, but it was at least a week. They don't want you touching it. You can bring electrolyte packets because water gets kind of boring if you're drinking a lot of water. We were drinking a lot of juice. It was beet juice, because you want to get your iron level up. You want that pineapple juice, the bromelain, I don't know how you say it, but you want that to help with the swelling and the bruising. You can ask your recovery house. I know that my recovery house did that. They made fresh juices almost daily. You have your electrolyte packets, little packet ones. You can buy those on Amazon or probably at the store, but one of your preference. Just make sure that you have something you can drink and make sure you're drinking. And if that gets you to drink more water, then all the better. Post-op vitamins, okay? I took post-op vitamins and maybe I have more energy than some of the girls. So I got the Heal Fast. I was actually taking the pre-op and the post-op. I did not take the pre-op after she said not to. You can't take anything the morning of surgery. So she said 9 p.m. at night, you can't have anything to eat. But I drank so much water. I overdrank on water. I was drinking, chugging, because I wanted to get all these liquids in me before my surgery because I didn't want to be fully dehydrated. You'll probably piss it all out in the morning anyway, but I wanted to give my body the chance to be hydrated. When you first get operated, and you'll struggle with this for a while if you have a tummy tuck and muscle repair, you can't really move. You're like a rag doll. It's kind of like being paralyzed because your abs don't work. And you don't realize when you get out of bed, you're using your abs. You don't really realize you're actually using your abs until you get the surgery. Even now, I'm 3 months post-op and I still feel sometimes it's a struggle, but it's getting much better. Also, I didn't really have the burning sensation from lipo until I got back home, which was probably by around 3 weeks post-op. I started feeling the burning, tingling sensation. So sometimes I'll feel it still when I'm laying down on my back and I'll get up and I feel this burning sensation. So that's from the lipo and it's just your nerves are reconnecting. I still have that. So I was told it should reduce. It should be significantly better around 3 to 4 months, and that's the case with me. It is getting better, and I don't know if I just didn't feel it because the pain was so severe in my abdomen that pain took over, but I didn't feel it for the first 3 weeks. Dominican Republic, I was only there 2 weeks after. I did not even feel the burning from the lipo until I left and got home. So I really didn't need anything to help with that. I did bring a back scratcher because it can itch. I may have used it once or twice when I was in DR. You're really going to feel hopeless to do things for yourself. And it kind of makes you feel a little depressed because, especially if you're a person that doesn't like to sit still, you have attention deficit disorder, you're going to feel kind of sad because you're going to be not moving and you're going to be like, damn, I feel old. I feel like I was 20 and now I feel like I'm 80 or 90 old lady or something. And it's depressing because you just want to just have energy and you want to be healed and you don't want to, but you're going to have to just feel old for a minute. And so just know that. And one thing that's going to help you, I do recommend this. I was going to say, I don't know if I should recommend it, but because this made me get up more, which is probably good for like blood clots. They say it's good. A lot of doctors do. Most advice that I've gotten from the doctors, even in DR, was that yes, you need to be moving, but they don't know how much I was moving. I was dancing bachata day 4. And then they said I was sitting down too much. They don't know what goes on in that recovery house. That was on my own behalf, by the way. I was the one saying I wanted to dance. It wasn't their fault. You're gonna need the picker upper. What is that? Yeah, they have nurses at the DR recovery. You can ring a little bell that they have and get a nurse. But it's kind of embarrassing. You feel so helpless. Like they gotta wipe your ass for you. You know, you might as well be able to pick something up off the floor. So how do you do that? You just grab one of those, I don't know what they're called. The thing you squeeze it, you get on Amazon. And you pick stuff off the floor. And man, that just made me feel so much better. And if I didn't have that thing, I'd have felt more depressed. Why am I gonna ring a bell to pick something off the floor? Because you can't bend over. You can only be at this certain angle. So they don't tell you that. You're thinking in your mind, I'm already gonna be bent over. I'm not gonna be able to stand straight, so I can bend over and grab stuff. No, you can't. Your range of motion is severely hindered. You're just like in this hunched over position, and you're not gonna be able to grab stuff off the floor. So if you drop something, you're in your bed, you're like, oh, I dropped the remote to ring the bell. How do you get out of that? Okay, so, and you can't even get out of your bed. Like in the beginning, it's hard to get out of your bed by yourself. You actually have to call them to help you get up to go to the bathroom. Slowly over time, you're able to get out of the bed. An adjustable bed is necessary. I had an adjustable bed, so you're gonna have to recline it up so you can kind of push yourself up, because you just don't have any abs. And so having that thing to pick stuff off the floor, just something simple, is so necessary. I'm so glad I had that. You'll have days where you feel exhausted and others where you might have bursts of energy, but those are usually short-lived. So if you're feeling like energized and you want to do stuff, just don't exhaust yourself. Take it easy anyway, because you'll get really exhausted real quick. People treat you differently. In a lot of ways, it's good. In some ways, it's like, because you realize like people just treat you different because you look good. I was raised to treat people the same, no matter if you're ugly or you're cute. You know, if you stink, we got a problem. I feel like I've always been raised to treat people right, no matter if they look poor or rich or beautiful or not as beautiful. Like, I feel like I always give people benefit of the doubt, but you're gonna realize that people don't do that. And you're gonna realize that when you look really good, that people are treating you different, which is a good thing. But at the same time, some people are disrespectful too. When they treating you nice, it's kind of like, wow, people are so shallow. So just be aware of that. Females, males alike. People treating you like you're a petting zoo. Like, can I touch that? What the No. Oh my gosh, I'm gonna have to bleep this stuff. When I got out of surgery, I thought my ass wasn't that big. And then you might have the feeling your ass is going away because the swelling is going down. And it will, probably around the month mark, it will shrink a little bit. Just a little bit. And you're gonna be like, oh my God, it's going away. But it'll stay, I mean, mine stayed pretty consistently round, so I'm okay with that. And it stayed consistent with my measurement. Use your measuring tape, because when the swelling goes down, you might feel like you're much smaller. And then also you're getting used to seeing yourself with a big ass. So, you know, you might feel like your butt is diminishing, but it's not. You got to get that measuring tape, and don't get traumatized. It's expected, because you're going to be really swollen, you know, but it's still keeping its shape. Just remember how you looked before and look at those before pictures. Also, my ass got so much cellulite on the bottom that I did not have before. I know I can work on that by doing treatments and things, and I'm going to look more into that and maybe make a video. But I've heard of Sulfina. It's a treatment for cellulite, but they don't have it in my city. I might have to travel, but I did not used to have dimples on the bottom of my ass. I got dimples there. I do have them now. I purchased a actual belly button plug. I'm so glad I did, but it was too big, so I had to cut it. And it's perfect size. It has to be so tiny, because Durán's belly buttons are small. I like them, they're cute. Let me see if I can show you my belly button. I had some tape on there, so it might be crusty. Yeah, there's a little bit of crust around here. There was like a band-aid, but it's a small belly button. So marble won't even fit in my belly button. I tried a pearl, I tried a marble, I tried so many things, cotton balls, earplugs. My favorite thing was that silicone It wasn't worth it because it was $30 and it's just a little thing, but it is worth it because you already invested so much. So just get yourself one. Mine was like a cylinder shape, circular cylinder shape that you push in, and it was like almost an inch long. It was so big, so I had to cut it like half, like I don't know if it was a whole inch, but it was big. It was really big. It was like way too big. So I just cut it and was like, I hope this works. So I tried everything else, and then I taped it on there, and it really is working for me. And then I put it in like peroxide to clean it from the band-aids. If you're using a band-aid or you're using tape that leaves a residue, it can irritate your skin. The residue comes off with alcohol. So I like to take a break away from putting that thing in there. But when I have a tight faja on, I notice my belly button looks all wonky afterwards. So I try to put that thing in whenever I'm wearing a tight faja. Probably I would say around month 3. I don't know if that's the right advice, but for me, I feel like around month 3, 2.5 to 3, you might not need to use that plug anymore. I started using it around like the first month. Okay, so that was my question, like when can I start using it? So I used it when my belly button seemed kind of like it was healing, but then it was like healing too much, and it was like one to become one with my abdomen, and I'm like, heck no, I need a belly button. So that's when I was like freaking out, trying everything I could. The earplug worked pretty good, but I don't like it because it's a porous substance, so I feel like it was not as sanitary. And if you put it in like alcohol or something, it becomes really a different type of material. So I liked it when it was dry, you know, but I didn't want to have bacteria. So that's why I like the silicone. You just put a little alcohol on a cotton pad or a cotton ball or a Q-tip, and you just rub it, it will come right off. I had a constant feeling of tightness in my abdomen mixed with random pains and tingly feelings. So that's just something to be aware of. The skin feels so hard after the lipo, especially like around here when she lipoed this area, like up to my boob, on the side right here. Man, that skin got like, it felt like some tough leather or something, but now it's softened, thank God. Like I was using a massage gun and stuff, but the percussion gun, the certain ones, I like the portable ones that have good ratings on Amazon. I don't know if I can link that, but I'm using one that I'm really liking the results from that. You don't do your massages, you can get that fibrosis, and you don't want that. So you want to soften that. And you'll notice right after a massage that you're going to feel softer. The skin does feel very hard, and you're going to have a burnt feeling, you know. You're going to be bruised more than likely. And some of them bruises don't even go away for like a month. For me, some of them lasted that long. Some of them go away within 2 weeks. But some of them be lasting. Like when they lipo you here, you don't know your breast is going to be bruised if you get lipo right here. Don't ask me why. I don't know. I guess the blood vessels are connected or something. But she didn't lipo my boobs, thank God. When you're wearing the faja in the beginning, especially for the first 3 months, you're going to notice that you have more energy with the faja on. When I wouldn't wear my faja, I'm like right at my 3 months, but like during my 2nd month even, like I feel so tired. The faja gave me energy. I don't know how to explain. It's like it kept it all together. Like I could just work and do whatever, and I don't have to worry about overworking my muscles. That is something to keep in mind. So you do want to wear your faja. I'm gonna be honest, like at night, it was really hard for me to wear my faja sometimes. And I have an adjustable bed where I can be elevated. I know you're supposed to wear it at night, but I would sometimes wear my #1 faja, and sometimes I would go commando. I'm just gonna be honest, because it was hard, because it's hard to breathe. You know, if you're having any congestion on top of it, forget it, it's hard. So I just rather breathe than care about if my waistline is small in that moment, and just wear it during the day, because I'm standing all day at work anyway, and so it's more comfortable if you're having a standing job. Another thing I'm going to mention is the BBL pillow. So I use the circle one for when I was in my bed, even on my adjustable bed where I can raise the feet and the head. Honestly, I don't even think it's necessary. If you have a pillow under your upper thigh, under this part, a big fluffy pillow, and then your butt, and then you're elevated here, and you're elevated here, and your butt is like right here, and then the pillow here, if that makes any sense. That's a good way to, because I was trying to figure it out. It took me like 2 months to figure that position out for me, and I don't feel like it flattened my butt, even though I felt like I was kind of putting some pressure on it. but I don't feel like that flat. And I felt like the BBL pillow was digging into my sides too much and like getting rid of my side booty. So I was like seeing indentation. I was like, oh heck no. So I did not pay for that. You can't see your butthole in the mirror anymore because it's too big. You have to open the cheeks. So when the swelling goes down, you can kind of open it easier. I got anal whitening while I was over there and it didn't even work, and it was a waste of money because, you know, but honestly, that thing is buried. They ain't gonna see it anyway. So I don't think that I would be interested in trying to whiten it because it's so buried and within my crack that I don't see a point in doing it. It's dark in there anyway because there's a shadow. It's not even that dark, but you know, you just want a light color booty. Please, once you got that big ass, they don't even care. You're not even gonna probably care about it. So if you get it and then you care about it, then just whiten it afterwards. I wouldn't recommend it. It's just a waste of money. And the person I went to was terrible. And he talked me into doing a vaginal tightening, which is a whole other video, but I would not recommend that either with the laser. He put that laser in me. It just burned the shit out of the insides. And let me tell you, I don't even feel like it made a difference. I still feel like the same. And I was hoping I would be feeling super tight. Honestly, I feel like the muscle repair did more for me than that vaginal tightening. If anything, I'm able to squeeze with my abs now. So don't even do that. I paid like $550. So save your money. Go get some Botox if you want to do something, or a hydrofacial. You know, I did a hydrofacial. I really like that. Do that. Don't do the anal whitening. I'm gonna wrap this up because this is, I think, the last thing I have on the list so far. So I know this has been an extremely long video, but I hope this has helped you. If you're in a recovery house, the last thing I'm gonna tell you is that put your initials on your tank top and make your nurse be aware when they wash your clothes, if they're washing them for you, like at the recovery house, that this is yours and it has your initials on it. And to make all the other nurses aware, they will lose your tank top because everybody has those cotton tank tops and yours might be the nicer one, and you get stuck with someone's tank top that didn't want to waste as much, or they don't want to spend the money like you did. So you want to have something comfortable and breathable for your skin that's cotton, that's seamless. And if you can't find seamless, a high quality material inside out without a tag will be best. If you went to the mall and you bought yourself those shirts and they cost you quite a bit, you want to have like 5 of them or so. You want to put your initials on those. Okay, so get white color or light color and just put your initials on where the back would be or something. Because you don't want to come home and you have to buy that stuff over again. Because that happened to me. They got lost because I don't think intentionally that they lost them, but they weren't there, you know, when I got home. So I had like one. I'm like, I brought so many with me. If you found this information helpful, please give it a thumbs up. Put down in the comment box whatever it is you may have a question about. Whatever it is, or maybe it's a video you want to see in the future. Hit the subscribe button. That way you can get those first thing and you can be on top of your recovery. Have a great journey, dolls. Bye-bye.